welcome. You're in the session entitled Making the Most of NTI, Coaching and Supervision for Mental Health Professionals. And NTI, of course, is the National Adoption Competency Mental Health Training. And welcome. I'm Edna Davis-Brown. I'm an implementation specialist for NTI, and we're with the Center for Adoption Support and Education, based out of Burtonsville, Maryland, but I'm here based out of my home in Silver Spring. My co-presenter today is my colleague and fellow implementation specialist, Lisa Maynard. Lisa, you want to say hello?
Hi, everyone. Glad to be here with you today. And I join you from sunny but chilly upstate New York. 39 degrees this morning. Burr.
Wow. Burr is right. So today we're so pleased to share information about NTI and, most importantly, an overview of our supervision, leadership, and coaching training that we offer through this project. So, but before we have a small group, of folks, so we can make this real intimate. Before we look at the agenda, we want you to introduce yourselves primarily using the chat, your role, your agency, and one thing that brings you joy. So your role, your agency, and one thing that brings you joy. And tell us where you're from, or share in the chat where you're from as well. So we just kind of want to see who's on this session with us today. And Lisa will be monitoring the chat. So Lisa, next slide. So we'll look at the agenda, and you can of course share things that are in the chat. I'll take a pause. No one's responded yet in the chat, so we'll keep it on push, so to speak. Of course, we still want to get to know you, and we certainly want you to engage by unmuting, because we'll be asking questions and asking for your feedback throughout the session. We'll review the learning objectives and give an overview of this online free training. We'll talk about the adoption competent mental health provider. Who is that? What does that actually mean? Because the words adoption competent have been mentioned so many times, especially during the last few years. We'll talk about NTI supervision and coaching approach, our approach to it. We'll review and practice some of the concepts and tools that can be found in this online training, this robust online training. Questions, we'll have an open Q&A at the end, but certainly throughout the session, you can unmute. And if my internet stable connection is unstable, I know that Lisa will jump right in. And we'll just make this very informal, since we have a small group as well. So let's move on to the next slide, Lisa. And if there's anything you want to share in the chat, feel free. At this time, I saw that there was someone from Idaho. I've been working, Idaho is one of my states actually, and I've been working with a state level agency wherein they've been offering NTI to all of their adoption and foster care workers as well. I think, gosh, it's probably about 200 folks in Idaho that have completed this training. Yes. So
Michelle, have you taken it? Have you?
Yeah.
No, not yet.
No, I am not. I actually provide parent coaching, and so I'm not going in from the Fostering Idaho, who I assume Edna is working with. I had heard they were working with. So no, I'm not. I haven't done it yet, but I wonder how I'll access it after this. So,
and we'll tell you.
Okay.
We sure will.
Yes.
And we have Stephanie from West Tennessee. Self-care brings me to it. Good.
That's awesome. That has been so important, especially during COVID. I can't say that enough. So good stuff, Stephanie. I'm us where you're from. If anyone has not shared what part of the country or what state you're from, please feel free to share that in the chat box as well, because we want to know which state you're from, because both Lisa and I, are assigned to states where we provide support with marketing and implementation and transfer of learning. So we want to be able to follow up directly in case your state agency or some other national organization or regional organization is offering NTI directly through their learning management system. So we'll talk a little bit more about that as well. But again, thanks so much for joining us. Next slide, Lisa. And I think many of you have already shared that in the chat box of your current role. If you haven't, please share that as well. Sometimes we get folks from the court systems, from law enforcement, from many different areas in terms of roles and functions. So we like to hear about that as well. Next slide. Adoptive parent. Thank you. Thanks for joining. Oh, that's Lisa. You're an adoptive parent. That's right. You are. And Lisa will share that as well. So at the end of the session, we hope you will be able to define at least 3 characteristics of an adoption competent, child serving professional, with a focus on confirming the need for adoption competent mental health services. You should be able to identify 4 competencies of an adoption competent mental health practice addressed by NTI and the definition of an adoption competent mental health professional. Finally, you'll gain a preliminary understanding of the tools and strategies NTI mental health and child welfare trainings for effective supervision, including a demonstration and practice of at least 3 effective tools for working with staff. So we'll actually be pulling out some of the activities and tools from the training and have you engage in some of those activities. So next slide, Ms. Lisa. Just as background, I mentioned that we're with the Center for Adoption Support and Education, CASE, primarily based out of Burtonsville, Maryland. It was created in 1998 to provide post-adoption counseling and education services to families in Maryland, Northern Virginia, and Washington, D.C. As a matter of fact, we just opened a Baltimore office. It is a private, nonprofit adoption services agency, envisioning that everyone touched by foster and adoption has access to adoption competent support necessary to navigate their lifelong journey. NTI builds upon the firm foundation of CASE and their views and experiences. To learn more about CASE, follow the link there, www.adoptionsupport.org. Each of you will get copies of the slides as well. So through our work, we
Oh, you back?
I'm sorry.
That's okay. Go ahead.
Okay, I'm back. Oh gosh, I hate this. Thank you. Jump in at any time. I don't know what's happening. Okay. So through our work, we've seen the need for change in how we address the mental health needs of children. And this NTI grant in particular is funded by the Children's Bureau. And it's an opportunity to address those needs. So Lisa, talk a little bit more about NTI.
I sure will. So NTI, here, let's go to the next slide. I'm responding here to Michelle. Thank you, Michelle, for sharing that. So NTI was awarded through, funding was awarded through the Children's Bureau. It was a 5-year cooperative agreement for $9 million. So I don't think we've said it yet, but NTI is a web-based, self-paced, and free training for child welfare and mental health professionals. And we have a colleague and a friend, Pat O'Brien, who some of you might know. He always says, well, NTI isn't actually free because the federal government paid for it. And I think that's kind of a nice thing to keep in mind. It's not like Edna and I sat at the kitchen table one day and just threw some PowerPoint slides together and called it an intensive adoption competency training. This took, oh my gosh, hundreds of hours to create and develop and do all the technical stuff that goes into a web-based training. So it's a real, as Edna had said, it's a very robust training. It's packed with tools and resources to enhance casework and clinical practice. It includes assessment and therapeutic strategies to address behavioral challenges, really lifelong challenges of adoption. And our great hope and desire is that it really does provide an opportunity for that shared language between child welfare and mental health professionals, so that there's greater understanding between the two, that shared language, so we're not talking about two different things, and then greater collaboration as well. So the curriculum, NTI is comprised of two separate but very well aligned curriculum. The one for child welfare is about 20 hours, and it covers, really covers all the core issues of adoption and then some interventions. It's 8 interactive learning modules, and it really looks at casework practice. How can you apply the core issues of adoption to the casework practice? There are, for the child welfare curriculum, 5 additional hours of supervisor-specific lessons, and that is to help supervisors with that transfer of learning. So we don't want this to be just an online class that people take and sort of walk away from and say, yeah, that was really good, and then never use it. This is really meant to be integrated into day-to-day practice. So the transfer of learning skills and the supervisor skills are part of that. The child welfare curriculum was approved by NASW for 20 credits nationally, and for the supervisor piece, 25 credits. So I don't think I said this, but the supervision piece is an additional 5 hours that really does look closely at that transfer of learning. The mental health curriculum is about 30 hours. It is, as I said, very well aligned and complementary to the child welfare curriculum. It includes 10 learning modules, so 2 more than the child welfare. And those are focused at, those 2 additional modules are focused on new assessment strategies and looking through an adoption lens. So interventions and therapeutic parenting strategies. It also includes information on 12 evidence-based treatment interventions that we talk about, and we're going to talk a little bit about some of them as we go along. It's not a training, so things like Darla Henry's 357 model or ARC or EMDR, these things are all included, information is included, lots and lots of links, lots and lots of resources, but we're not training on those things. So I think that's a pretty good overview of NTI. Our competencies are listed here. Again, they are the core issues of adoption. We talk about trauma, we talk about loss and grief, positive identity, race and diversity, and then in the mental health portion, assessment and treatment planning and therapeutic parenting strategies. A comprehensive list of our learning objectives, of our competencies, of the outline of the training are all available on our website. And if you could put our website in the chat box, that would be great. Easily accessible. Our website is just got so much information on it. You could be, lost in there for hours. And we encourage you to. Okay, so why is specialized training needed? Why do we think that's needed? Do any of you think it's needed? Yeah, I see a couple heads nodding. Yeah, specialized training is needed to deal with the issues that come up in foster care, adoption, guardianship. Life experiences, trauma, early loss, children who enter foster care, guardianship, adoption, they all come with a whole suitcase full of stuff, right? They all come with baggage because of what they experienced in their original homes. Many have experienced early losses, multiple moves, abuse, and neglect. And these things have an impact on children. They experience elevated risks for developmental, physical health, emotional health, and behavioral challenges. And, you know, having that knowledge base to deal with these unique issues in foster care and adoption is really important. So this here is a photograph of my very dear friends, Sue and Hector Bedell. And so some of you might know Sue Bedell. She's an internationally known speaker and advocate on adoption. She's sitting right here in the middle, and her husband Hector. And this is them with all their children. These are all their children, like, right? They have 22 and a couple of children by birth. Most of the children were adopted. So they have all kinds of experiences in their family. They've got physical health issues, they've got mental health issues, lots of loss, sibling groups, complicated family, complicated issues. Like the most amazing family I know. I'm just such a huge fan of Sue. Lots of trauma, lots of developmental needs, lots and lots of stuff. So no doubt you've worked with families who have some of these issues. Maybe not everybody, you know, not all these issues in the same family, but perhaps very likely that you've worked with all of the kinds of things that they've dealt with. So what are some of the things that you've found in your work? Your work with children and families, what are their experiences? Anybody?
Yeah. Feel free to use the chat box or just unmute. We'd love to hear your voice too.
Hi, this
Many
is
of the
May.
same complexities. I'm sorry.
Yes. Yeah.
Many of the same complexities that were mentioned previously, you know, mental health, behavioral issues, just some of those same things as far as dealing with families. You see that in the families that we work with day to day. So, yeah.
Yeah, thank you.
They're similar.
Thank you, Stephanie. Renee, you were going to say something?
Yes.
Thank you.
Just like Stephanie was saying, you know, lots of layers, lots of trauma, you know, trauma that it is not just even undisclosed, but not detected until the children are triggered and they don't even know why. And then a lot of times parents that I work with are unprepared, had no idea. They came with the traditional view, love can heal everything. And, you know, the children are adopted as infants and they're not understanding that a lot happened in utero that can have a lasting effect across the lifespan. So the parents are traumatized, secondary and unprepared, and the child is traumatized, but not even sure why.
Yeah, great points, Renee. Thank you so much. And I love that you put in that little plug for children who are adopted at birth. It's the same thing, that prenatal trauma, right? When mom is pregnant and is experiencing high levels of stress, traumatic experiences, domestic violence, that impacts the fetus. That impacts the brain development of the fetus. And oftentimes we sort of, in the past, we really haven't paid much attention to that. I also have worked in this field for a long time, and oftentimes people go into adoption and they do not have the entire history of the child. There are some agencies, some states who don't share all of the information until after the child's adoption is finalized, which I think is a little bit crazy. I mean, it really doesn't do anybody justice. We need to know what we're getting into, right? The parents need to know what to expect for school, what to expect for physical health and mental health. And so to not disclose some information is really not helpful. Then, as you said, Renee, there's the things that we just don't know about yet. Nobody has documented the experiences. The child has maybe had experiences pre-verbally and they don't know it either. But all of this comes out in once the child is in a safe and stable family. So yeah, lots of. Yeah.
Lisa, there was a comment from Diane. Families reaching out with son, daughter, PTSD, isolation, suicidal thoughts. We have helped them with support, listening and resources, and visiting her farm. We'd love to hear more about that, Diane. There are children with suicidal thoughts as young as 7 years old as well.
Yeah. Doesn't that just break your heart? At 7. Yeah, thank you, Diane. So what are the characteristics of a competent adoption, competent mental health provider? We believe that they have the requisite professional, educational, and licensure to provide services. That they come from a family-based, strength-based, and evidence-informed approach to working with children, youth, and their families. They have a well-developed clinical knowledge, skills, and values in working with children and youth with a history of early adverse experiences, and have some experience with working with children who have come from, through the foster care system. The system has an impact as well, right? We believe that they need well-developed clinical knowledge, skills, and values in working with adoptive and birth families. We don't want to leave the birth families out of this, right? That has an impact as well. When we talk about kids in guardianship and kinship care and foster care, and with really the proliferation of open adoption, which I believe is really the best way to do an adoption, we're going to be interacting with birth families, and they are going to have their stuff. The adoptive family has their stuff, and the adopted person has theirs as well. So really having a good understanding of how those all intersect. And then the ability to work with adopted children and youth and their families with sensitivity and respect for racial, ethnic, cultural heritage, sexual orientation, gender identity, mental health, physical health, or disability issues. So like the whole gamut, right? Pulling that all together. That's a big ask, isn't it? And, in our experience, in most of the states that we have worked with, none of this knowledge is part of the social work mental health education. I did my MSW late in life, and the only time adoption was mentioned was when I brought it up. And the only class we had on adoption was when I taught it. So, it's just not part of the fabric of social work education, mental health education. And I think we do a disservice to children and families oftentimes. So the adoption competent mental health professional is highly skilled in conducting full assessments using a wide range of evidence-based and evidence-informed promising therapies that are trauma-informed as well, to effectively engage families toward the mutual goal of healing the child, helping the child to heal, helping the family to heal, empowering parents to see themselves as the healing agents, experts and advocates for their child. So, the expert is not the therapist. The expert is not the child welfare provider. The parents have to be empowered to make good assessments themselves and feel like they have the power to get the services they need, and have the professionals understand that what they're talking about is real and important. I work with a mom who adopted a 7-year-old from China, and he's now 11, and he's got Down syndrome, and he's acting out. And at the clinic, the local clinic here in New York, they were told to put in more rigid expectations and boundaries for this child, and to not worry so much about worrying about attachment, focusing on what I would think is the attachment work. And they were like, wow, this, we've been doing that. We have been putting right, rules and boundaries on, and we just don't seem to be going anywhere. But this child is functioning at a 2-year-old level. He spent 7 years in an orphanage. He needs the attachment work. So the clinicians who are really not informed oftentimes do more harm than good. And then being engaged with extended family and other networks to support adopted children and youth and their families. Okay.
Great.
Edna.
Lots to cover. So anyway, thank you, Lisa. So NTI, essentially this training that we're talking about, that we're going to demonstrate some key pieces from, it provides skills, strategies, and tools for child welfare and mental health professionals. And it's so rich and packed with downloadable resources and tools designed to support children to heal from trauma and loss, provides parents with skills to parent more effectively, and improve child and family well-being to increase family stability. So those are all packed within this training. And again, so many resources that just immeasurable. So next slide. Now we're talking about some tools for supervision and coaching, but we want to acknowledge first that we know supervision is hard work. And thumbs up or just an indication of how many of you are actually supervisors, just give us a sign using your reactions, because we want to know who we have in the audience. You're tasked with fulfilling mandates and assuring compliance, tasks within timeframes, all while supporting your staff through what is most of the time heartbreaking work. There are so many challenges before you: large caseloads, multi-problem families, bureaucratic policies, high staff turnover, burnt out or desensitized staff, and just initiative overload. My, lions and tigers and bears, oh my, that's a lot. You don't need to do more. You need to have that your staff are using the skills and doing the work that can make a difference for children and families. So we believe that staff who have the right skills, the right tools, and are coached to do the best practice have increased competency and a sense of accomplishments in families they serve. This in turn leads to what? Increased staff retention, which ultimately makes your work as a supervisor more effective and efficient. So we, again, have built in tools and to actually address this. Let's look at some purpose and objectives here. One of the things I wanted to mention is that most recently, Lisa and I did a 3-part virtual training with the state of Mississippi. It was around 36 case managers and supervisors. And it was a virtual free course because all of the case managers there had completed NTI along with their staff. So we actually worked with them to incorporate tools, activities, resources to work with their teams to help them transfer knowledge and skills since they had completed NTI, to really help with the day-to-day practice. So the purpose of what we've put together, the highly interactive skills-based coaching and supervision experience, is really designed to assist supervisors and supporting staff to cultivate the skills and the competencies embedded in NTI, promote transfer of learning from training to day-to-day practice. How about you? I have attended many trainings by many different organizations. And once I finished the training, I'm like, okay, well, how the heck do I use this day to day? So the purpose of our approach is to really help with day-to-day application. And finally, to support staff and utilize solution-focused intervention, utilizing tools and resources in NTI. Let's talk about the value of coaching your that training alone does not change behavior or result in the ongoing use of skills. We know this personally. So after completing training, workers might incorporate some new skills, or they might go back to using the same familiar skills they've used before. However, when staff are coached to use newly learned skills in their daily work, the result is changed behavior that can be sustained, and sustainability is really important. As a supervisor, you have the opportunity to coach and support your team members in the application of new skills, tools, and resources that they will learn throughout NTI training. Again, NTI training is so packed with tools and resources. We believe that staff who have the right skills and tools and who are coached to do best practice have increased competency and a sense of accomplishment, as well as a belief that they can possibly impact the children and families they serve. So it leads to, again, increased staff retention, increased skills, competency, and hopefully positive attitudes and values. Next slide, Lisa. Let's talk about our toolkit. We're going to go through some of the tools and resources that NTI gives us, really to refresh and reinforce those learnings and skills. When we conduct the training, each participant is given a pre-session reading. So we send them readings that they should complete before the training. And some of our tools, like we have NTI tip sheets for each module. Say, for example, for the child welfare module, there are 8 of them. So we have 8 tip sheets that really, really reinforce coaching and activities. So they review the coaching guide as well as the tip sheets to get that's going to be covered for that session. Next slide. So we talked about the 3 sessions that we've done with Tennessee and Mississippi and Alabama as well. So those 3 sessions might cover modules 1 through 3, modules 4 through 6, and then the last modules 7 and 8. For example, so we do team discussion. When we talk about actually doing coaching and supervision, we do activities like team discussion, case review, and often with our training, we have folks from that particular group submit case studies prior to the session. Say someone may submit a case study on trauma or identity formation, and we use those case studies to actually discuss during the training. Role play is a big part of it as well. And I just love role playing, team activities, application kinds of activities. So we try to make it as fun as possible and make it as engaging as possible. We also have supervisor videos that we developed with the University of Maryland on different topics. You'll be seeing a couple of those today, and we'll be happy to share links to those videos as well, because several of them are YouTube videos. So those are really, really good videos to use with your staff and really have some discussions. So how do you do supervision in your work setting? Feel free to use the chat. Just curious, do you do it one-on-one? Do you do it in team meetings, group practice sessions? Do you do a case record review? What are the things that you are doing in terms of supervision in your work setting? Feel free to use the chat. If you're doing something you want to share with others that might not even be listed here, I would love to hear them, because we can also share those with other folks that we work with. One-to-one. Someone said one-to-one supervision once a month. Any others? How do you do your your supervision, if you'd like to share? And if there's others, please feel free to share those as well. Okay, next slide, Lisa. So here's a snapshot of, it's directly from our supervision coaching guide. It really focuses on module 3 for promoting secure attachments. And here it talks about how you can support your staff to use the following 3 skills And then it actually gives some actual examples and tools that they can use. And these tools, again, are embedded in NTI. So that's just kind of a snapshot. And then you could do it individually or do it in a team setting. So let's go to the next slide, Lisa. So again, the guide includes different types of activities. Again, team discussion, case study, role playing, team activities, and application. One of the things that Mississippi did with their case managers, they actually got together and put together a format for using or creating life books. So they wanted to create something that their staff could use, a little cheat sheet that they could, something that they can have in hand that will help them, families and kids, around developing a life book. And we'll talk a little bit more about that as well. So it's real user-friendly and something that your staff can actually use in day-to-day settings. And we want to really reemphasize that. We'll get into some of these in a minute, and we want you to be a part of discussing how useful they are and how you might be able to use them in your settings. So Lisa's going to take us through one activity called How Diverse is Your Universe? Lisa.
Thanks, Edna. Yeah, and I just would like to reiterate something that you did say. Our coaching and supervision guide is it's a sort of a manualized way to use the tools and resources and activities that are built into NTI in your supervision, in your work with colleagues. And we also do provide that one-on-one training. Edna and I could lead that for you if your agency or organization was interested in it. And again, it's free because we are funded by the federal government, and just a really nice resource. We totally understand that you guys are overworked and underpaid and underappreciated oftentimes. And it's our role to help implement and integrate this in your system. So we're happy to have a discussion with you if you have an interest, or if your leadership in your agency has an interest. So we're going to do an example of an activity that talks about, that addresses the issues of race and diversity. And this is in Module 4 in the mental health training. And it gives staff and your colleagues, and you could also use this with parents, prospective foster and adoptive parents, gives a visual representation of diversity or the lack thereof in their circles, right? In their world. It can also be used, as I said, with training foster and adoptive families. It's just a really great visual representation. So I'm going to ask you to do a virtual version here. So maybe take a piece of paper and draw a little cup. So maybe you draw a little cup. Oh, can't see my little cup. All right, can't see my little cup. But draw a little cup or a little, bowl or something like that. And in this activity, when we do it in person, we've got multiple colored beads in little clear plastic cups, and each person has a plastic cup of their own, a clear plastic cup of their own. And every bead represents a different race or ethnicity. And you could make this up as you go along. When we do it, when we lead it, we give you, the colors. So white would be white, and black would be black, and brown might be Indian, and yellow might be Asian, and so on. Okay. So kind of stereotypical, but we're just sort of assigning colors to the beads and races to the beads. And for each of the questions, and I'm going to just throw out a few things, you're going to take a bead that corresponds with that person that we're representing, okay? So with your little cup, your little piece of paper, and your pen, maybe just use a word or a letter to symbolize, right? So if I ask you a question about who is your, think about your dentist, and your dentist is white, you're going to put a little W in your cup, okay? So whatever you feel like assigning as the colors. So we're going to take a little take a little test ride here. It's not as fun virtually as it is in person. So select a bead or write a letter that most closely represents your ethnicity. So just one bead, one letter. Next, select a bead that most closely represents the ethnicity of your significant other. And then a bead for your closest friend. A bead for your dentist. Go back to our dentist. My coworkers are predominantly, and maybe you put in a couple of different beads for your, so let's say your 3 closest coworkers. If you're in school, my classmates are, or if you were in school, maybe think back to when you were either in college or high school. My classmates were predominantly, maybe put in a couple different beads. The people in my social circle are predominantly, again, maybe pick three different people in your social circle and put a bead for them or a little letter for them. Then the author of the last book I read was what race? Yeah, what was the last book I read? Yeah.
For me, it's not which book I read, it's did I pay attention to who the author was?
Oh yeah,
or
right?
their race.
I can remember I remember the face of the person, the last book I read, but I can't remember the title. Remember the story, it was a good story. Yeah. Okay, so now you've got your piece of paper with, because it's so funny when it's in a little green screen, right? You've got your piece of paper with your different beads in there. So what does your cup look like? What is the predominant color in your cup? Anyone?
White. Michelle is white, her predominant color, or people. Anyone else?
Who else? Does anybody have a multicolored cup?
Yeah, Diane has a mixture of colors.
Cool.
Is that a mixture, Stephanie? Thumbs up if that's
Yes, ma'am.
true. Mixture, step from Stephanie.
Great.
So it sounds like it's a mixture. And you know, it's interesting, mixture. And I have a mixture as well. And it's funny, guys, I shared this with Lisa before. Sometimes it depends upon where you are in your life. Because before I moved to the Washington, D.C. area, I lived in Northern California. And my cup was like popping, man. It had beads, all kinds of colors, because I lived in Walnut Creek. And despite the primary ethnic makeup there, interacted with folks of all races and hues and that sort of thing. And even though Washington, D.C. is a multicultural area, my cup in California was much more vivid in terms of the beads. So it was just interesting, just coming in terms of interaction and that sort of thing. So
yeah, depending on where you live. Yeah. In my last home, my neighborhood was really lived in a really nice suburban neighborhood, but I had African American neighbors, Asian neighbors, Indian, Eastern Indian neighbors. It was really a very, a real interesting ethnic mix. It was a community that was sort of transient in that people were coming in and out of working at the university nearby, the medical university nearby. And then I moved into an older neighborhood, still in the suburbs and still in the same suburb, but mostly people who've been here since they built their home in the 50s. And it is, it is pure white. It is sparkling white for sure. So yeah, yeah, Jenny says my cup was diverse when I lived in Houston, but in Connecticut, primarily white. And so this is just a really good exercise to give you pause, right? Make you think about, wow. And I consider myself to be pretty open. I'm actually pretty extremely liberal, and think I have a great range of friendships and people in my world. And then I do my cup and I'm like, no, not so much. I add my 2 Korean-born children in there and I get a little bit of color. And some of my colleagues from CASE, I get a little bit of color, but predominantly white. And so what do I do about that? Thinking about what I need to do about that. Yeah, so Diane says, oh, from Diane. Okay, cool. Thank you, Edna. So this is a great exercise to do again with your staff, with colleagues, or parents. Diane raised her hand. Diane, go ahead. Thank you for raising a hand.
Oh yeah, absolutely. So in doing this, when you said about the book that we read,
yeah,
and what goes through my mind is I read the book and watched the movie and actually did it for a paper when I was in college, The Pursuit of Happiness. That just says it all, doesn't it? I mean, that's what I was thinking as we're going through this. And it was like this positive energy. And I just wanted to share that.
Thank you. Thank you. I really appreciate that. Pursuit of happiness. Yeah, that's great. Okay, so this is a really easy exercise to do. And Edna and I are going to be doing this in a workshop coming up in person. And I just ordered these little tiny beads and they were $3.99 for 1,000. So it's not expensive to do. That's the point of that. You know, little package of plastic cups and you've got a nice little exercise to do with your staff. So now we're going to take a look at a case scenario and sort of think about concepts and how to help a child, help a child's adoptive parents. This is in a transracial adoption, talk about identity and ethnicity. And again, this is sort of, it's related to the module on race and diversity in NTI, and it's sort of an example of how you can talk with kids and families when there's an issue around race and diversity. And I'm going to say in any transracial or transcultural adoption, there is an issue of race and diversity, okay? So we've got this scenario. Little Luther is a 5-year-old African-American male adopted by a middle-class white couple with 2 children born to them. So they've got 2 white kids, ages 8 and 12, and little Luther, who's a little brown boy, who's age 5. Luther recently asked his adoptive parents, why don't I look like you and Jenny and John? My skin is darker. Will it get lighter like yours? Where did I come from? He also asked them whether they are his real parents. So many of you who've worked in this field for any length of time, I'm sure you've heard this question. I hear the question from kids who are in same race placements as well. Are you my real parents? Certainly heard it as my children were going through school. Well, where's your real mom? The question being asked by other children, by the way, by other parents, who's their real mom? So those kinds of intrusive questions and, you know, insensitive questions. Where did I come from? Why is my skin darker? How would you respond to this child and this family? How would you help support them in having that discussion about adoption? Oh yeah, Michelle, one of the most intrusive and offensive siblings questions, is that your real sister or your adopted sister? Yeah, I heard that all the time. Wait, are your kids real brother and sister? Yes. Yeah, the answer is yes, that's my real sister, right? Yeah. So what do you think? How would you how would you help the parents address these questions? Because they're coming in and they're saying, oh my gosh, I don't know what to say. You know, how do I talk about this? You know, I'm colorblind. Color doesn't matter. Would that be a good answer? What do y'all think of colorblind? Are we? Raise your hand if you're colorblind. No, Renee says, and your child isn't colorblind. And Diane says, no, you're not colorblind. We can't be. It's in our, it's in our makeup to categorize people. We notice things. We're not colorblind unless you absolutely have, a visual anomaly and you can't see any color. And even then, I think the people who are colorblind just can't see red and green for the most part. But yeah, we're not colorblind. We're not meant to be. So it does make a difference. We make assumptions based on what we see.
Yeah.
Yeah. And so we need to help them understand the child's history, how to help them preserve the racial, ethnic, and cultural identity, right? Have to maybe give them some tools to use, right? Which of the following strategies would not be recommended? Oh, I already gave it away, darn it. Have an open conversation with Luther about his birth parents. Help him feel safe in asking questions about his race and ethnicity. Help him to learn to be colorblind?
Nope.
No.
That's a bad no.
That's a bad no, right? Yeah, great big bad no. Introduce Luther to social and cultural events and people, I would say, to expose him to his race and ethnic heritage, and help him maintain connections with birth or extended family. And so some of these are a little bit daunting to white folks, right? How do we talk about birth parents? How do we talk about birth families when the child came from a really hard place, when there was abuse and neglect in the birth family? That's a hard concept for a lot of our pre and post adoptive families to think about. How do we maintain connections with extended family or go to cultural events? How do we put ourselves out there to be like one of a very few in the minority? As again, I'm talking about being a white person going into maybe a Black Lives Matter rally, or into a Black church, right? I remember when my kids were small, we attended the Korean church. It was all, the whole thing was in Korean, so we didn't understand any of it. But it helped my kids to see that there were other people like them. It was uncomfortable for me in a lot of ways because Koreans are not so accepting of adoption in general, at least when my children were young. They're 31 and 34 now. So it was uncomfortable and I didn't know anybody, and I wasn't sure how to be friendly with people when I didn't know the language and the culture, but had to learn, had to do it for my kids.
Yep. There are a couple of comments. Okay. One back up this problem and start with books that introduce ideas. Would love to hear about the books. And you said this is daunting for a white family. I think it comes up for the dominant culture, but it's hard for other cross-cultural experiences.
Absolutely. Yes, Michelle, great point. Yep. You know, there's transracial, transcultural adoption that happens in different ways, right? Yeah. Somehow we don't think of it that often. You know, what? A Black family adopting a white kid? Does that ever happen? Yeah, it does, right? I've had that experience in my years in this work, for sure. Good point. Thank you so much. We talked about this. We covered that already. This is a role play. Edna, do you want to kick this off?
Yeah. This is a video, and Lisa, jump in case something starts wacky. I got my camera off just in case it gives me a little bit more oof.
Okay.
This is Jaleesa. So this is a video, one of the videos that we use in our training or in our coaching. Jaleesa talks about another move for Jaleesa. I won't go into too much detail about it, but I'd like for you to take a listen to this video and really try. Lisa, let's see if we can play the video.
So Dawn, I just got another phone call from Jaleesa's foster parents. This is like the third call this week. And one more thing, one more problem. She's stolen food again. We've gone through, we've already in place like what we needed to do around that. And I feel like really the thing that's in her best interest, because it just feels like it's absolutely out of control and not going to improve, would be to move to another placement. I just feel like this relationship is just damaged beyond repair.
I mean, I understand how frustrating it is. I mean, I keep getting the calls where you feel like it's just sort of devolving and not improving. My concern, though, honestly, is changing placements also is going to be a real challenge for Jaleesa. I mean, so to think that just changing the placement somehow solves the problem, it might solve the problem for the parents. They're not dealing with it anymore, but it doesn't really address the issue for Jaleesa. So whatever's going on is likely to happen, or something similar is likely to happen in the next placement. And so what I really want us to do is to think really long and hard about what we can do. Have we done everything that we think we can do to support both Jaleesa and her foster parents before we move to just changing placements? So why don't we do this? Why don't we spend some time kind of like doing a postmortem on this case, right? So thinking about what have we done? What have we put in place? What strategies? What services are in place to support Jaleesa and her family? And then figure out if there's anything we've missed that maybe can help us and help them to have a more successful family experience, if you will.
So,
Edna, are you with us? I think Edna's having a little bit of technical difficulties. So just an example of a scenario that you can use with your staff. Again, these role plays are built into the NTI curriculum, and they're downloadable. You could use them in the curriculum, or you could download them and use them in your staff meetings. So just an example, and I think we've got, gosh, it might have 8 or 9, something like that built in. So just kind of noting time, and I think we've got until 1:30 Eastern time. I'm going to talk about the application of some of the tools that are embedded in, for example, the ACEs, the adverse child experiences, some sample questions. So in this assessment, there are 10 types of childhood trauma measured in the study. 5 are personal. There's physical abuse, verbal abuse, sexual abuse, physical neglect, and emotional neglect. and 5 are related to other family members: a parent who is an alcoholic, a mother who is a victim of domestic violence, a family member who is in jail, a family member diagnosed with mental illness, or the disappearance of a parent through divorce, death, or abandonment. And each type of trauma counts as one. And so you guys have probably seen this. And if you haven't, you can just Google the ACE study, and you can get all of the questions. So every question gives you, every one that you answer yes, you get a 1 point. And the higher your score, the more trauma you've experienced or the child has experienced throughout their lifetime. And the more trauma they've experienced, then the more likely the risk of health consequences, physical health, mental health consequences. The study showed that there was a stunning link between childhood trauma and chronic disease, as well as mental health issues. In the NTI, any questions about ACEs? And again, that study is, the link to that study is embedded in the NTI training. We've got just so many resources. It's really kind of ridiculous. There's so many resources. You could spend an extra 20 hours looking at all the resources we've got embedded in that. Okay, so shared activities as a team are another way to enhance understanding and improve practice. So inviting a speaker to come to your team meeting, if you do regular team meetings, having book discussions, taking some, one of the books, Michelle, that you've got on your book list about adoption or foster care or loss and grief, abandonment issues, any of those things can be really terrific. Watching a movie together. I don't know who's heard of Jean Strauss. She's a friend of mine and a filmmaker, and she's done some fabulous videos on adoption. She's got a website, and I'll try and either put that in the chat if I get a chance to do that, or make sure that you have the link after this workshop. Lots of really terrific videos. There are videos done by a Korean adoptee. Lots of really good videos out there to use, and to do a panel, right? Bring in people to talk about these things. Have a group discussion. That shared learning is such a great way to get this embedded into your day-to-day practice. Having a panel of teens come in and talk about their story. I did this at a conference that I ran a few years ago, and man, the teens are super honest. They just totally let it out. They talk about their experiences. They talk about what was useful and helpful for them. And they also tell us all the ways we've messed up. And, that's a good thing. We need to learn from the kids who are having the experiences, right? We need to know. We do good work. We try our hardest. I'm totally confident of that. But sometimes we mess up and we don't know it. So better to know what we might do some work on. Edna had mentioned life books a little bit earlier. She's having a lot of trouble with her connection, so I'm just going to keep going. So life books are a great way to document a journey that the child has had. A lot of agencies have a life book sort of written into their practice. When they're working with foster kids and looking toward adoption. But a lot of times this sort of falls by the wayside as we're trying to do all the rest of the documentation and take care of appointments and all that kind of thing. And what we have found is, Edna mentioned in, I think it was Tennessee, having a format, having a template, and a policy that says we're going to do this for every child has really been useful for them. Some of the things that get in the way of doing life books, just not enough time, right? They're hard, they seem to be hard to do. They seem to take a lot of time. but they're not as hard as one might think, especially if you've got a template. It's best to start a life book when the child first enters care, when you have access to birth family who might be able to provide baby pictures, right? Pictures of the home. We talked about this in a recent workshop where, if a child doesn't have a picture of their original home where their birth family lived, if you go to Google and type in an address, most often you can surprisingly find an aerial view of the home and sometimes a street view of the home. It was a little bit shocking to me when I put in my address. There we were with my car in the driveway, by the way. So a little weird, but really useful in this case. Little pieces of information that can help the child know and understand their story. So lots and lots of ways to do this. You can do it digitally as well. There are lots of ways to create digital stories. We've got links embedded in the NTI training for those as well, those resources as well. Another little sampling of other tools that we've got embedded into the NTI training. The bird's nest drawing, Mr. Nobody, whose job was it? These are activities to do with children to help them sort of have an understanding and by the way, to communicate their understanding of what their life is or has been. They may have trouble sort of processing it, but drawing is often a way for kids to get good in touch with their memory. Creating a life box, a loss box, or a memory box. This is a great activity, again, to do with children. By the way, this is a great activity to do with parents because our kids' losses oftentimes hit on our losses. All right, Edna's back. Welcome back, Edna. Do you want to take
that never happened.
It's okay. We got you covered. You want to say anything about our tools here?
Oh yeah, we have lots of wonderful tools. I have a question though. Have any of you used any of these tools? The life book work, loss box and memory box, which is something wonderful that could actually be a box that's created with all of the memories and the key pieces of things that children collect, whether it's pictures or items. And again, with the life book work, we have sort of formats and tools to use that as well. Lisa and I will be doing some of that work next week in Texas. Journaling, probably as you are working with families and even individually, because I journal, I love journaling, that you can get your kids to be involved in writing in their journals, which is a wonderful tool of recollection and things like that. Digital stories. Kids love using the internet and using their phones to take pictures and all kinds of things. We can create stories and memories digitally as well. Storyboarding. I don't know how many of you have used, someone's familiar, Renee is familiar with life book work. Storyboarding, another key piece as well, and in creating different parts. It's like a parts of a puzzle, really, in terms of key things that's been happening in a kid's life and putting those pieces together as they travel through time, so to speak. Narrative therapies, again, focusing on stories and narrative things to create that the child can engage in and the family can engage in as well. And we have a wide range of evidence-based practices that we've listed here that we highlight in NTI throughout in terms of what they involve, include, and really have some examples and background information on those pieces as well. And I see in the chat box, some of you are using some of these tools. I love, we talked about assessments. Lisa probably already talked about this, Mr. Nobody and whose job was it? Those pieces. And maybe next time, Lisa, what we could do is include some of those physical examples in our work or in our presentation as well, so folks can kind of see what they look like and what they involve. Yeah. So these are all tools embedded in NTI. It's a way to really make connections, really gets to attachment issues. So it's really, and some of these things can be really fun and revealing as well. So next slide, Lisa. Any questions about any of these? It sounds as though some of you have used some of these tools in your work. I want to really focus on the NTI Coaching and Activity Guide. We've referenced that quite a bit. It's the actual guide with the activities and suggested sort of things you can do with your staff to encourage the coaching and supervision piece. This is where it's located on our website. It's a supervisor coaching and activity guide, and we've actually updated this a bit. So this is a great tool that's on our website that you can access, and we highly encourage you to do so. So we have so many great resources on our website. So just want to point out that particular one. And we can send you the link as well. We talked about tip sheets. We have tip sheets for each and every module, both child welfare and mental health. The tip sheets, again, highlight activities, case management kinds of practices, all kinds of things that's relevant to that particular module. And then we have some topical tip sheets on attachment, trauma, things that are really more topically focused as well. And these tip sheets really sort of support and accompany the coaching guide nicely. We have transfer of learning tools. We have a guide for actual transfer of learning. So there's so much packed into what we've done online. We encourage you to go online and take a peek at these. Particularly those who are going through the training, and maybe even those who have completed the training and didn't get a chance to take a look at these tools. Go back, take a peek, and use some of these tools with your staff, because again, it really reinforces transfer of learning, skills, application, all those wonderful kinds of things. So next slide, Lisa. Now, how do you get to this training? And Lisa will put the website on the chat box. You have different ways of getting to it. I want to first mention access on CapLearn. This is the child welfare sort of portal. This is an immediate way that you can get to the training. Right now, the mental health training is not up yet, unless I've missed that. It will be up by the end of November. But right now on CapLearn, you have access to the child welfare and the child welfare supervisors training. Also, by the end of this month, you will have access on the case LMS. Both access are free of charge. You just get on and get busy with the training. And again, all three trainings will be available on the case LMS by the end of November. Now, for some of you, I think there was a couple of states that mentioned that they had heard of the training. We are working with states who have actually sponsored the training on their own learning management system. Idaho is one of those, for example, and there are several other states. There is actually a link on our website that gives you a listing of the states who have access to the training via their LMS. So you may want to check that out. I'm trying to remember where that is, Lisa. I I think if you look under access options for training, it will have a directory of states and national organizations that currently house the training on their LMS. You take a peek at that because some of you may already have access through your state level or for that training. So we encourage you to take a peek at that as well. And a reminder, if you're accessing it via CampLearn, in order to get your CEUs, they are purchased through Cassidy Seminar. So say, for example, you complete the child welfare supervisors training. Your CEUs are available through Cassidy Seminars, and it will have instructions regarding that. So say, for example, you've got 20 CEUs, it costs $40. That's not bad at all. 20 CEUs, $40. I think in some cases it could cost a whole lot more. So that's your way of getting your CEUs through CampLearn. With state agencies, we are encouraging them to what trainings are available for parents. We do not currently have any trainings for NTI through NTI for parents. We do have access to a parent training through another project, which we can provide you with the link to. CEUs, thank you, Lisa. Through the CASE LMS, the CEUs are actually free. So once that's up and running, you can go through the CASE LMS and get your CEUs for free, which we have coordinated through NASW. So free on CASE LMS, $40 on CampLearn, which is available immediately. Okay, any other questions or comments, or just feel free to put those in the chat box. And yes, we often, when we're presenting throughout the country, people ask that question about parent trainings, which is definitely a great need. So we are working through an organization that currently has that available. I don't have it in front of me in terms of the link, but we will get that link to you. All right, next. Now we have on our website, it's actually you have access to a directory of NTI trained professionals, and particularly mental health professionals who've completed the NTI training. So this is a way to find out who in your state or who in a neighboring state has actually completed the NTI training. So there's several hundred folks listed in this directory. It's a great resource tool to go to. You may want to check it out. Say you're interested in making a referral for a family or a youth who needs support, and you can check this out to see who might be close by where you live or work that has actually completed the NTI training. So we want to encourage folks to also, once they've completed the training, they can upload their certificate of completion, especially if you're a licensed therapist or a therapist that works with kids, to include your name in this national directory. So it's a great referral and resource tool that we want to encourage you to use and encourage you to put your name in once you've completed the training. So another great resource. What questions do you have? Any questions or comments or things you might want to ask that you didn't ask before? Any questions? I'm checking the chat box.
So 2 questions came up that that just to share with everybody. So it doesn't matter if your state has got this uploaded to their LMS or not. This is available to anyone in any state, tribe, or territory in the United States, including Guam and what was it? The Marshall Islands, I think we heard from recently.
Yeah.
And we're hoping to visit there someday. But it's available and free to all child welfare and mental health professionals. We've also had folks who are CASA workers, guardian ad litems, child protective workers. It's called the Adoption Competency Mental Health Training. but it really is for anybody who works with children and youth who have come into the child welfare system or who have been adopted anywhere from birth to 18 years of age. We've got lots of information embedded in the training about post-adoption services. We've got search and reunion, birth family, relationships. It really just runs the gamut. So free and accessible to anyone. And as Edna said, we do have a partnership with an organization that's doing parent training. I think it's Spalding, but we will get that information to you.
Yes, it is Spalding.
Yeah.
Yes, it is Spalding, Lisa.
We'll make sure we get that information to you.
And I can we advocate for this resource to be provided to school? Oh, heck yeah. We would
Please.
love to, yes, please. We would love to be connected to school systems because school systems have counselors and other key people that we believe that this training would be very beneficial for too. So yes, we would love to be able to connect with school systems. We presented at a couple of national conferences for school personnel. We've been able to penetrate in some states, but not as near as we would like. So this would be definitely a great tool for.
Right. And we also did a pilot in with a school system, and I think it was in the DC area. So we do have we have had educators and school social workers do that as well. Is there a way for us to become trainers? Well, you don't really need to become a trainer. You just use the product, use the website. Take this and run with it. We're happy for you to do it. The other plug I'd like to put in is that we really are trying hard. Our real focus in the next year is to get more mental health professionals on board. And so it's a little bit more tricky than reaching out to child welfare agencies because there are a lot of folks that work independently in private practice or in private agencies. Yeah. Any suggestions that you have, any recommendations, any contacts you have for us to reach out to in order to engage mental health professionals, we would really, really love to hear from you who those are. And if you can, make an introduction for us.
Yeah, absolutely, Lisa. And someone was mentioning, yes, Michelle, we need to connect for sure, Michelle. And there are lots of parent resources built into it, meaning that we have handouts, all kinds of tools, assessments, things that professionals can actually use with parents. As a matter of fact, I think the last sort of session we had with Mississippi, there were a couple of folks, child welfare people said, oh, this handout worked great with my parents. I downloaded it and printed it, and I used it with my family. So there are also tools that are really, really day-to-day things that you can include in your work with families. So we encourage you to check it out. Take a look at this training, take it, complete it, and you'll really be pleasantly surprised at how useful and practical it is for your day-to-day practice. What else do we have?
I think we're good. If there are any other questions, we'd be happy to answer them. And if
Question,
not,
this is Renee.
yeah.
Do you guys have your own conference? Because I mean, I could sit and listen to this all day in a couple of days because there's so many layers to it.
Yeah.
And I think there's so many professionals and parents who would benefit from just a conference that focuses on this important topic. So if you want funding, this is a good idea to go out and get one because it's really needed. You know, I work with Jenny and in Favor in Connecticut, and it depends. There's so many needs depending on the community, and we find that it can differ depending on if the adoption was, you know, international or domestic, was through our local DCF, which is our Child Protective Service Agency, or if it was private. the level of education of parents, expectations, it just varies so much, but the children are the same. You know, it's the same trauma and the same. So I just want to say, if there's ever an opportunity for a conference, go for it.
Thank you, Renee. And Renee, so Connecticut is one of my states, and Edna and I have divvied up the states all across the country. So it's one of my sites, and I have not actually had been able to make any headway in Connecticut. So I would so love to talk with you.
Okay, definitely. We'll send you our emails.
That would be so awesome. Yeah, I put our email in the chat, and it's
Awesome.
also here. Would really love to figure it out. We can come to you and talk to your state and or your organization.
Definitely. Thank you, Lisa and Edna.
You're welcome. You're quite welcome. And yes, we will make sure we get your email addresses so we can send you things directly. I believe we can get that through our contact here at this organization for this particular session. So we'll make sure we do that and follow up with you. Okay, if there aren't any other questions, we really appreciate your time. I'm so sorry I disappeared on you, but Lisa is wonderful, and we always have each other's back. So we'll be, as I said, we'll be taking off for a Texas conference. So all masked up and ready to rock and roll. So we're looking forward to that experience. So thank you so much for joining us. We'll make sure that you get the slides as well. Please contact us, because we want to follow up so we can work to get NTI to your organization and also provide you with some of the resources we mentioned earlier today as well. So thank you. Have a wonderful weekend and enjoy the rest of the conference.